Looking at health insurance as asset protection. Many people are aghast when I give them the quote for the health insurance, and the premiums on an annual basis is approaching 8% of their household income. And for many of these people, they are healthy, never had an accident, never been in the hospital, never seen a doctor, and they just can't see paying that much money for something they don't use and they think they never will use. I get it, it's expensive. To offer a different perception of what health insurance is and how it fits into our lives, I talk about health insurance as asset protection, such as homeowners insurance for your house or your auto insurance for your car. And looking at the premiums I pay for this home, currently the annual premium is $2,066 per year, and the replacement cost that they're going to cover is $398,000. But that's not all that I get to pay. I also have to have flood insurance. And the annual premium on that is $824. And the maximum limit they're going to pay to replace this dwelling in the event of a big wave flood is $250,000. So then I start going through in my mind, well, I figured out the kind of the average cost of my homeowner's policy over the 20 years that I've owned this home is about $1,500 a month. The flood insurance was about $500, so that's $2,000 times 20 years. I've paid $40,000 in homeowner's insurance, and I've never filed a claim, not even for a fence or anything. Health insurance has no cap on how much it will pay on your behalf, unlike the flood and the fire insurance. No cap. Now, there is a maximum annual out-of-pocket amount that most health plans have, and it's anywhere between $5,000 to $10,000 per year. So once you have accrued healthcare expenses that meet the maximum out-of-pocket amount, then the health plan pays for everything for the rest of the year, regardless of how much it cost. That's not too bad of a deal when we look at it, because if we think about major surgeries or cancer treatment, that easily goes over $100,000. So having to spend $10,000 and having an insurance plan cover the other $90,000 plus, that's not too bad. And I then also think of how we have used health insurance over the last 25 years. Because with homeowners and auto insurance, that will cover some minor claims, but it's not for routine maintenance. Your auto insurance isn't going to give you a discount for an oil change or a brake job or replace your tires. But you can use health insurance to reduce those routine expenses. And I think of the maternity costs that the health insurance picked up part of. The surgery for the broken leg of my son, where they had to put in a plate. The cancer scare and the tests and the procedures that entailed to rule it out. I got paralysis in my shoulders from some sort of adverse reaction to the shingles vaccine, but we didn't know what was going on, so that took a lot of time and tests. And of course, there are the routine office visits, labs, and that we have every year. And that is a value that health insurance provides that homeowners and auto doesn't. That doesn't completely account for the high cost of health insurance. Part of that is that, again, there is no cap on how much the health plan will pay on your behalf if you come down with a major injury or accident and are in the hospital for a long time or need lengthy treatment. So that's just one way of looking at health insurance from a different angle, that health insurance is asset protection, because if you do have something serious that happens to you, you could lose the house because you may need to sell it to pay the hospital bills. So again, that's just a different perspective on health insurance, that it could be viewed as asset protection. So for InsureMeKevin.com, I'm Kevin Knaus.